Welcome to Focus Today. I'm your host, Perry Atkinson. And one of the things that has come out of this coronavirus is the acceleration of what we're calling telemedicine. And very timely for us to have with us today, Dr. Jonathan Baugh is the Chief Medical Officer and co-founder of Remote Health Solutions, which is a telemedicine company. He's been testing and treating, I should say, the COVID-19 patients. And so what an honor to have him with us today. Dr. Baugh, good to see you. Thanks for your time.
Thanks, Perry. I appreciate it.
All right, telemedicine. Man, this is kind of interesting. What is it?
Well, if we look at what telemedicine is, we can look back at the early days. That was really, truly telephonic communication. That was a doctor calling a patient on their phone. And then came along the opportunity to have some video assistance with FaceTime type conversations. Now, where we are currently, especially one of the things I love to brag about Remote Health Solutions and our current technology, is the ability to have video, voice, live streaming vital signs, data collection, all at the same time over low bandwidth capabilities.
That's wonderful. So you obviously been doing it, and what's the procedure? What do you do in order to qualify somebody via technology as to whether or not they may have the virus?
Yeah. So here's where we sit with that as far as being able to identify COVID-19 patients or patients who are infected with the SARS-CoV-2. That true identification still needs to be done through laboratory tests, but what we can provide is a couple of things. We provide the opportunity to unburden the hospital. If somebody needs to just see their physician, we might be able to do that as well, where they don't have to go into the doctor's office. Or where we're being used a lot right now is a natural extension of one of our areas of expertise, and that's what we call remote patient monitoring. Where when somebody has a chronic illness, a chronic condition, diabetes, congestive heart failure, hypertension even, what we do is we send home a device with those patients. It has some associated peripherals, blood pressure, oxygen saturation, glucometer, Bluetooth scale, those type of things. We send that home with them. In this situation, maybe after they've been diagnosed and they don't need to stay in the hospital. They have COVID-19, but they are stable. They can go home to their home and we can monitor their vital signs. Their information gets stored on our device, gets forwarded to the cloud, and then we have some artificial intelligence that then sorts through that information and helps us to know which of those patients need more close attention and which of those patients we can reach out to turn the tide of their own personal disease. We do that all the time and been doing that for a while with these chronic conditions to be able to keep them out of the ER and to keep them out of the hospital and improve their outcomes. Now, that's been a natural transition for us to take care of COVID-19 patients in their home.
Amazing. Are you spending a lot of your days in front of a computer screen now?
Right now, yeah, definitely more so than before, even as me personally, because normally I'm not a provider over telemedicine. I do two things as far as what I'd say my daily work goes, and that's I'm still a practicing in-person ER physician, and I want to keep my boots on the ground. And then I also run sort of managerial level this Remote Health Solutions. Me and my founding partner, Adam Hardage, we're based out of Richmond, Virginia. Wow. And with that being said, now more and more, I'm actually stepping into some of this role of being in front of the computer.
Dr. Baugh, are there levels of COVID-19? Am I hearing you say that?
Yeah. So you're right to be able to say levels, but in the sense that we know that about 80% of the patients who get infected with the SARS-CoV-2, the virus that's causing COVID-19, they will be asymptomatic or only mildly symptomatic. They will, in that spectrum, feel like they've maybe got a mild cold. And then we know about 15% of the population will have some real disease. They will feel more sick. And then we know here in America, 1% to 2% of the population will die. That's the current mortality rate. In Italy, it's a 10% mortality rate. In Spain, I think that they're about at 6% when we look at all these numbers. Across the world, we're about a 4% mortality rate. So yes, there is a spectrum of how seriously affected by COVID-19 an individual will be. Some of it is based upon their current comorbidities, whether they have pre-existing diseases that will affect them, but sometimes it's not.
You know, we hear the numbers of the common flu, if I can use that word, common flu versus COVID, but COVID-19 seems to be A, highly contagious and attacks the body differently. Can you explain that?
Yeah, that's great. One of the things that we know that is very different about COVID-19 is its transmission rate.
Hmm.
It is approximately 3 times more transmissible than the standard flu. So that's why we've really implemented this social distancing, this shelter at home, this opportunity to try to separate ourselves from other people. And then, as you mentioned, it also affects us differently with more people getting more sick. We look at raw numbers, and we know that the influenza, the yearly flu infections, will kill between 20,000 and 60,000 Americans every year. But its mortality rate is lower than COVID-19. It's still well lower than 1%. So it affects differently. We're having different reactions to it. One of the reasons is because we do not have an inherent immunity to SARS-CoV-2 or COVID-19. And so as a community, as a world population, more people are getting it. It's more easily transmissible, and we're being affected at a greater, higher rate than the standard flu every year.
So, how do you treat somebody with COVID-19? What's the treatment?
Uh, so right now, it's funny when we talk about viruses. Typically, we say just symptomatic treatment. Listen to your mom. Plenty of soup, plenty of fluids. Go home, get some rest. There are some things now that we're finding that we can do with COVID-19, and it is still a lot of symptomatic treatment. If they need a breathing tube to be intubated, then we do that. If they need breathing treatments, then we do that. If we need to supply IV fluids, then we do that. But there is starting to come out in the literature just now some evidence that hydroxychloroquine, especially coupled with azithromycin, may be very helpful. And so the literature is coming out, the experiments are being done, the opportunity to be able to find a true treatment right now is just on the verge right now. And so that's probably our best treatment option right now, hydroxychloroquine and azithromycin.
We hear the numbers of people who get it, and we hear the numbers of people who are dying from it, but we're not hearing the numbers of people who are being cured. It's substantial, isn't it?
Yeah, it is. In fact, I'm looking above the camera right here because I've got the Johns Hopkins website up, and we see throughout the world, we see 491,000 total infected and confirmed cases, 22,000 deaths, and 118,000 recovered. And so you're exactly right. It is substantial. That's what we talked about before. 80% of people may not even know that they got it, or they will think that they had a mild infection. And only 2 to 10% in Italy of individuals will not recover and will die. And that's a horrible tragedy. But we do have to remember that means that even in the worst scenarios, 90% of people are getting better. And in America, it means that 99 or 98% of the people who get infected with COVID-19 will get better.
The FDA, Dr. Baugh, seems to be putting potential vaccines on a fast track, not only within the United States, but those who are coming into the United States. I know Israel has set some stuff over in other countries. Are you hopeful there?
Yeah, I am. I think that's we have a really great strength in this country, and that's great science and the ability to move things forward. So if we look at previous vaccines and sort of stem off of that a little bit, we can bring forward a great vaccine that will help. That honestly, it won't help this year, but it will help for next year. It'll help for next season. And that's what we need to remember. I think that we will be helped dramatically by a SARS-CoV-2 or a COVID-19 vaccine, but it won't stop it this year, but it will help for the population for next year. And I think that that's very important for us to understand and important for people to reach out and use.
The reason I asked that because usually the history of these viruses, there would be a second wave. But we're hearing that talk even today, of the possibility of a second wave. So to work towards a vaccine obviously is extremely important. But do you think that might be the case with COVID-19, a second wave?
Yeah, I do think that that is a possibility as we look at um, the wave across the world is what's the reinfection rate? And that's basically what we're looking at. Is it going to be within this year or is it going to be next year? Is it going to be within a different population? Obviously, we have been told that between 40 and 70% of America and 40 and 70% of the world population will probably get COVID-19 at some point, and that might be because of that second wave that you talk about.
Hmm. You know, one of the other things that came out of this, Dr. Baugh, is that, I mean, the medical communities now are our heroes. And so thank you for your service. That's amazing. That and truck drivers. Can you imagine that? Um,
Yeah.
and that is that this thing really kind of caught us unaware. We just didn't have the medical supplies. What are we learning from this?
I think we're learning that we do need to be prepared all the time. As individuals, I think that we do think about preparing for those events where we might not be able to go to the store for a few days. Hopefully, people are preparing now more in the future to be able to stay home for a couple of weeks or maybe even a couple of months with some basic necessities. But on the healthcare level, I do think that being prepared for some long-term needs is now been pushed to the front, and I'm hoping that with this stimulus package, we will be more prepared for the next big thing. I know that's one of the proposals that we've put forward is the opportunity to help with that next pandemic, help people be prepared. So we're actively working to be in that arena to help for the next COVID-19-esque event.
Were you surprised to find out how much of our pharmaceutical ingredients that we are dependent upon other countries for them, such as China?
Yeah, I was, even as a healthcare professional, I know that in my daily practice, we have a whiteboard up that lists the medications that are hard to get or the ones that we're out of that we might use on in another situation. This is before the COVID-19 infection came. And
Mm.
so we always knew that there were some hard to get or hard supplied or low supplied medications. When this event happened and we learned that most of those medications and many of our antibiotics, in the range of 90% of medications and antibiotics come from China, to me that was pretty that was eye-opening and shocking and realizing that we are America, we have the capability, we have the best minds in the world. Let's manufacture here. Let's protect ourselves. Let's always be cautious. That's always the smart thing to do.
Yeah. And lastly, back to telemedicine, are more and more of your colleagues asking their patients to call them now or connect with them via computer?
Yeah, I think so. I will caveat that by saying I'm not a family practice guy. And so if we talk about my true colleagues, we talk about emergency medicine physicians. But I do know that more and more family practice physicians, primary care physicians, are finding opportunities to utilize telemedicine to reduce the burden in their office and also to try to maintain some social distancing from possibly infected patients or from patients that they know are at risk already. In my world, we are and have been and will continue to use telemedicine. We've been using it for years with telestroke, and now we're using it for infectious cases as well.
Well, let me say to our viewers and listeners, Dr. Baugh heads up Remote Health Solutions. You can go to rhsusa.com. That is his website, rhsusa.com, and check out his provisions there. Dr. Baugh, thank you. You're fascinating, and thanks for giving us your time. You can be anywhere, but you've given us a few moments. I'd love to stay connected with you.
Yeah, thank you, Perry. I appreciate it. I'd love to as well.
All right, God bless.